good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern Steinberg School of Medicine, who answers your COVID questions and addresses the latest COVID news every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering your questions and addressing the latest COVID headlines through today, the 3rd of March. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Buskowski, who is a student research assistant with the Institute. So Sophie, go ahead and take it away.
Thank you, Kristen. Hi, Dr. Murphy.
Hello.
And now for some updated COVID statistics. Fortunately, we're seeing a huge decline in COVID cases. We're seeing a 7-day average in the United States of about 54,000 positive cases per day, which is about what we were seeing during the summer of like 2021. In the United States, yesterday, we saw 58,000 new positive cases. We still have an incredibly low booster shot percentage of under 30%, but hospitalizations have decreased by 43% and deaths have decreased by 21%. In Illinois, we're also seeing a very, very low number of cases, with our positive cases of a 7-day average of about 1,721. But yesterday we saw about 1,500 cases, with the death and hospitalization rate both significantly decreasing. So Dr. Murphy, should we be jumping up and down with these statistics? Should we be celebrating, or should we be freaking out a little bit because this is like the calm before the storm?
Well, it's great news that the numbers are down and continue to go down. It doesn't look like, we were nervous that, maybe it's going to have this long tail where, it stops going down so fast, but it looks like it's just continuing to drop. There's still an awful lot of cases, 54,000 cases a day, considering that it's a 1.2% mortality rate, that still adds up to some deaths here. But it's all going in the right direction, and it's really terrific news, and justifies why the mandates have been removed in most places now. I think Hawaii is the only holdout, and so we'll see. We'll see how it continues, and if the numbers go back up, maybe we have to put some more mandates back. But right now, it's going in the right direction.
Yeah, absolutely. And that ties right back into our biggest COVID headlines. Are Americans ready to ditch the COVID restrictions? It's complicated. What can you tell us about this Kaiser Family Foundation study that was conducted?
Yeah, no, it's interesting that, there's still a lot of people who are at high risk for getting a serious infection and ending up in the hospital and maybe dying. So 30% of the people have some kind of risk that getting COVID is not a good thing to do. So they're very nervous. And of course, they think that these restrictions have been removed too soon, because they're the ones out there, facing people who, a lot of them are not vaccinated. No, not as many people are wearing a mask. But it really is amazing, just walking around here in Chicago, how many people are wearing a mask, and how many stores and event spaces are still asking for vaccine cards and still requiring people to wear masks. So it's not like it's just disappeared, and I think that's good. It should be sort of a gradual change in behavior and mitigation, and we'll see in a couple weeks or a couple months if this is going to hold up, and let's just hope it does. But we'll see.
Yeah, absolutely. And now for a rather sad COVID headline, the WHO says the war in Ukraine will increase COVID transmission, putting a large number of people at risk of severe disease. What can you tell us about what's going to be happening in Ukraine and Russia with COVID?
Well, I mean, any kind of civil disturbance like that, I mean, is going to, put people jammed into, underground shelters, subways, and whatever. People from all walks of life mingling and not necessarily using masks. I mean, they're more interested in staying alive and not getting bombed and shot at. Right. And so everything has to be put into perspective. But, and then, over 1 million people have left the country. 1 million people. This is like bigger than a lot of states just are gone, and they're clogged up at the borders, and it's just a recipe for disaster. So especially if there was a new variant that pops up, but that remains to be seen. But yeah, no, I mean, the WHO is just putting out, hey, look, we're taking all these refugees, we just have to be careful about COVID too. Don't forget about COVID. At least this is not happening during the Omicron peak.
Right.
So that's a good thing, but it's just adding to the whole tragedy.
Yeah, no, absolutely. And now for our first question. This individual is 85 years old and has scarred lungs with part of his lung collapsed. They have gotten, excuse me if I missay this, aspergillosis.
Aspergillosis?
Thank you. In the past, they have 2 vaccines of Moderna, and 6 months later, they had the booster, which was in August 2021. It's been 6 months since their booster, and we're wondering if they should get a second booster, which would be their 4th shot now in February.
Yeah,
what can you tell us about a high-risk individual of this age getting a second booster?
So if this person was living in Sweden or Israel, they'd be given a 4th dose. They're over 80 years of age, and they have terrible underlying lung disease and are immunocompromised, because you just don't get aspergillosis. It's got to be something else really wrong underneath a medical problem. So this person actually, in some places, would get a booster. Now, whether that booster is really going to help or not, we don't know. Technically, it's not approved yet in the United States. If I could just order it, and a person like this, I would just order it, but that's not how it works here. So there's a lot of data now on the boosters. The boosters, we don't know the optimal schedule for these vaccines. So there's a couple things associated with vaccine potency. Number one is the dose. All right, so they can play around with the dose. Like with Moderna, there's the high dose and the half dose, which is the booster dose. Do you get more bang for your buck with the high dose? There's some evidence that maybe you do, but then you also have more side effects. So there's a trade-off. Then there's an issue of between dose 1 and dose 2. Some people think, and there's some data that shows that if you spread that out a little bit, you get a better immunologic response. Instead of the 3 or 4 weeks, you make it 8 weeks, 12 weeks, maybe that's better. So that's another thing we don't know. And then this booster, we know the booster works. Clinically, less hospitalizations, less ICU admissions, less death, if for the boosted versus unboosted. When is the best time to give the booster shot? It was originally 6 months, and then it was 5 months, and originally it was even longer than 6 months. But anyway, so it's somewhere around 5 or 6 months after the second dose. A second booster, it's been looked at just in a few studies, and it didn't show like much benefit. So Israel and Sweden think that there's enough data. They're convinced that people, and it depends on which country, if you're over 60, 65, or 80 in Sweden, and you have some underlying disease like this patient that we're presenting here, that a booster may be beneficial. We don't know. So in the US, it's not approved yet anyway. And in a way that's good, because the data are showing, you just don't boost yourself out of this whole pandemic.
Right.
There is an optimal schedule. Many vaccines are given, once every 5 or 10 years even, that you don't need to keep overstimulating the immune system. You don't get much bang for your buck. So it remains to be seen. So right now in the United States, the recommendation is this person just to hang in there. They've had their vaccines, and they're basically as good as it's going to go. If they could get a 4th shot, they should, but it's technically not possible for this person in the United States.
Right. Well, understandable. Now for our second COVID question. Would it be safe for two 70-year-olds who are boosted to go to an indoor concert at an all-state arena? What would you recommend, Dr. Murphy?
Well, if they're otherwise healthy and don't have a lot of risk factors other than being 70 years old, and they're vaccinated and boosted, and the rates are as low as they are now, they should go, but they should wear a mask when they go.
Yeah, absolutely. And now for a third COVID question. I know you covered this a little bit, but why does the fourth shot not give more immunity for some people, but gives more immunity for other people? Wouldn't it just be the same as getting a second shot, or the third shot? It's a little confusing, and the media has been portraying it in a very confusing way.
That's because nobody knows. Nobody has the answer.
Yeah.
So that's why they're presenting it in a confusing way, because they don't know. So anyway, I kind of touched on this already with the first question. You just having a whole lot of boosters doesn't necessarily help. And so we have to figure out what the optimum schedule is, and it goes back to whether you have 3 or 4 shots or whatever. And right now, nobody at the CDC or NIH is convinced that anybody needs a second booster yet. So the other thing is, from a public health perspective, is we can only convince 28% of people to get the first booster. So we should focus on that, because we know that the booster shot really does help. That third shot is really great, does wonderful things. Everybody should be boosted, but the second booster, it's uncertain really if it's beneficial.
Yeah, absolutely. And now for our last and final COVID question. Is there any more information on BA.2 variant or any new variants that are occurring? What can you tell us about BA.2?
Yeah, so BA.2 is some 30% or 50%, some percent. It's more transmissible than BA.1, which is the regular Omicron, or BA.1.1, which is a variation of that. Disease-wise, it's about the same, which is less serious than the Delta. All right, Delta had worse disease, but Omicron was so contagious, all the numbers went up because so many people got infected. If you look at those numbers, it was really staggering how many people got Omicron. So will BA.2 take over and cause another wave? That's really the question.
Yeah.
So in South Africa now, they're over 70% BA.2. Remember, that's where Omicron started. So it's logical that the next variant is going to come from there. In Denmark, it's about 20% have BA.2, which is about what we have on the coast of this country. But in the Midwest here, it's very low. It's in the single digits. It hasn't caught on as fast as it could have. Now remember, Omicron was 3 to 6 times more contagious than Delta. So here we're only talking about 30% maybe. That's all. It's incremental compared to the difference of Omicron, which is like 300 or 600%. This is only 30%. So anyway, so that's where we are with BA.1. It's out there. It's spreading. We don't have much here. It's up a little bit in Africa, actually a lot in Africa, but they're not having a giant wave. They are having more cases, but it's not like some giant peak like they had before.
Right.
So it's out there. So we're really waiting for the next variant and see what that does. Right now, the only thing more contagious than Omicron is measles. Now, most people are vaccinated against measles, but that's the only other viral disease we know that's even more contagious than the Omicron. So we're getting close to kind of the maximum contagiousness that's ever been reported in history. So we'll see.
Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
Great. Thank you.